biomedical sciences have progressed tremendously, but still the global crisis in healthcare is deepening. I put question marks because there could be different opinions, and I don't want to force my opinion on each one of you. So these are the question marks, and we have to find answers on our own based on what is happening around. The affordable and accessible healthcare is becoming a distant dream. The triple burden of disease and epidemic of non-communicable diseases is really causing us a lot of worry. Diet, lifestyle, socio-behavioral changes around us are happening, especially in India, when we are adopted the Western lifestyle, Western diets, and our original culture and original diet, we are losing very fast. Our millets have gone, and ragi is being replaced with oats and other exotic material, which we don't know whether they are really suitable to us. Geriatric population in having at least 2 to 3 chronic conditions, and there are reports that most of the geriatric population is on 4 to 5 medicines every day. The high-tech interventions and pharmaceutical drugs are becoming too myopic. We are going in a super specialization mode, wherein super specialists are not getting the total picture of human body and human mind. The societal expectations about drug safety and efficacy are rising, and the disease prevention and health promotion, which should be at the center stage, it has been taken over by therapeutic and cure based. This is happening because unfortunately we have a colonial mind even now, and we were forced to believe that health can be given through medicine and by doctors, which is not true. Health and medicine are not synonymous terms. Health is based on 4 important parameters, or we call them as determinants of health, which include genetics, nutrition, lifestyle, and environment. And as you can see, except genetics, all three are in our hand. Environment also is becoming more and more polluted, so that also is going out of hand. But nutrition and lifestyle are completely in our hand. We can decide whether to go on a healthy path or an unhealthy path. And once any one of these 4 pillars of health becomes weak, you need a support system to maintain that balance of our own home. And that support system is medical care. But we have started thinking that that support system is the only thing to protect our health, which is not true really. We talk about SDGs and we talk about universal health coverage, but for a country like India, unless we involve and integrate AYUSH systems, which are our own systems, universal healthcare in India is not possible. Currently, we are witnessing a situation wherein we are using term healthcare, but actually we are giving medical care. So the care is actually about primary healthcare, family medicine, health promotion, and health prevention. But we are in cure mode, which is about hospitals, surgeries, drugs, and diagnostics. And from cure, we are even moving further to scare. During COVID, we have seen that we were actually scaring people. This is coming up. This is going to happen. Even drug, if you look at different advertisements coming up in the newspapers, they're scary advertisement. If you have diabetes, there is a risk of amputation. So people are getting scared. And then we are even moving further from scare to scam, which we saw in COVID-19, that medicines which were proven to be not effective in randomized controlled clinical trials were sold in Indian market in black market actually. What we are today witnessing. So the availability, accessibility, and affordability of healthcare is emerging again as a major problem, and we are actually living in what I would like to call it as a medicalization of society. On one side, there is a curative practice dominance. On the other side, there are market forces, and all this is really influencing our healthcare today. While the typical evidence level is going high because of the high quality and more scientific research happening, but because of the commercialization and its impact, the value systems are going down. So while high levels of evidence we are able to witness, low levels of ethics is something which is worrying us. This is US data, and why I'm using US data is many times we have in our mind that US is something which we should follow, but the health system in US is not worth following. They are really in deep trouble. So they found out that what are the 10 top causes of deaths in US. They found out that first was, of course, heart diseases, second was cancer, and third was medical errors. Imagine, third cause of death was medical errors. Now the JAMA data 2021, because of COVID-19, this third position has been taken over by COVID-19, and they have changed the term medical error to unintentional injury. The basic message remains the same, that a lot of unintentional injury or medical error or iatrogenic diseases or whatever you may like to call, these are result of interventions or medical interventions which are happening. They are actually emerging as a major causes of disease. People are really worried about medical overuse, and journals like Lancet, BMJ, JAMA, they're coming out with series of articles on the themes like less is more. That means less medicine will be more effective.